There's a fascinating psychological phenomenon in career psychology called work-role saliency. If your job is just a paycheck, you have what's classified as low work-role saliency. If what I do is who I am, then you have a high work-role saliency. The profession with the highest work-role saliency is obviously artists, as their work is a reflection of who they are as a person. Have you ever tried to criticize someone's art? Yeah, don't do it, because they will take it 100% personally, because as you will see, they will view it as a criticism of them as a person, which makes perfect sense. They are at the top of the list. What's interesting is that the second and third groups on the list are the people in the healthcare, number 2, and the people researching healthcare, number 3. Doctors, nurses, social workers, and researchers view their work as a moral mission. These roles require a deep alignment with their values like empathy and service. It's viewed as a high-stakes role, life and death, and the sacrifice required, their schooling, long hours, emotional toll. All of these factors make it impossible to ever switch off that part of their identity. And I'm not saying it should. Once a doctor, always a doctor. But this comes with a huge problem. It becomes a profession with potentially deadly levels of cognitive dissonance. It's literally at deadly levels because science is an ever-changing dialogue. It's not a set of static rules carved in stone. So when good new science comes out that shows that the doctors were actually doing harm, their brains make it impossible for them to see the new information, let alone change their stance. It's because they see and identify themselves as good people who dedicated their lives to helping others. And I'm not questioning their motives, and I 100% agree with them. This is just a factor of human life on this planet that we have to deal with because we are so hardwired to stay with the tribe. We view changing our opinions like being kicked out of the tribe, which was a death sentence. I made a deeper dive video about that called The Anthem of Truth, linked in the comments below. The first recorded event in modern medical history regarding deadly levels of cognitive dissonance is certainly the story of the Hungarian doctor named Ignaz Semmelweis. In 1846, he was the one who correctly applied the scientific method to correlate data in a hospital, showing that doctors were infecting and killing their patients, mothers and their newborn babies, because they were not washing their hands after working with diseased cadavers. His thesis was small bits of these cadavers were getting into the babies' and mothers' bodies. He tested all kinds of things, including birthing position, hearing a priest's bell or not, ringing for last rites, ventilation, crowding, washing one's hands and instruments with soap and water, and then a 4% chlorine solution. When he presented his information, he carefully explained his observations, his question, and his hypothesis. He explained how he designed his experiments and testing protocols. He analyzed the data, retested and retested before he drew his irrefutable conclusions. Within months, the mortality rate dropped 915% in his studies. When his fellow doctors were presented with this information, you can see the high work-role saliency taking place. They oddly didn't ask him questions about his hypothesis. They didn't query him about how he conducted his experiments. They didn't pepper him with questions about his data analytical methods. They didn't ask him any scientific questions. Not one. Why? They were all highly offended that Semmelweis was implying that the doctor's actions were the cause of their patients' deaths. And in their mind, that's impossible because they are caring, loving people who help others. Yeah, that's not what his study was about at all. Can you imagine you've done all the proper science? You're saving over 900% more people, and everyone is upset with you for a totally unrelated issue. He was vilified, fired, and eventually committed to a mental asylum where he died of an infection at 47 years old. Fast forward to today, and you can see the exact same thing. Watch this clip closely.
And this is just me wanting to have an open debate about this. Vaccines are really the one thing we have looked at as causing autism.
I agree with you. That is completely bogus. That is such a bogus statement. How many vaccines have they looked at in these studies? How many? What's the answer? It's 2. How many ingredients have they studied of 35? What's the answer? It's 1. You've looked at 2 of 36 shots and 1 of 35 vaccines, and you're going to stand on the stage and say that vaccines and autism are unrelated? It is the most bogus tobacco science. It's a smokescreen, and anybody who takes the time to read it would agree. I'm so sick of doctors who don't read the studies, who don't know the details, sitting here telling parents and reassuring them that vaccines don't cause autism. It is irresponsible.
And this is the biggest problem, and the reason that doctors in this country are frustrated.
Read the
because,
science.
listen, all you're doing is you're antagonizing a medical community that wants to help these kids.
You haven't done the research.
You're antagonizing me. You're antagonizing Dr. Sears. Right. Why would you do that? This show is all about his
my son.
Okay, everyone wants to blame someone, right? Yes. This is what we're trying to figure out here is how to help kids. But all you do when you yell at me on my stage, all you do is anger me.
I'm sorry
and
I hurt
make
your feelings,
me
but you didn't know the details.
I asked you to defend your stance, and all you did was attack me.
Identically, the doctor didn't refute the science, the quality or quantity of the studies. He instantly took it personally. We're trying to figure out here is how to help kids, which is true, because he identified himself as a helper. I mean, he's a doctor. He dedicated his life to it. High work role saliency, right? And it is impossible for someone who identifies as a helper to ever admit they caused harm or were duped. Cognitive dissonance prevents it. Dr. Peter McCullough is an American cardiologist and internist who ranks in the top 0.01% of scientists globally by academic impact. He has over 8,400 citations and has authored 680 peer-reviewed publications in elite journals like The Lancet and JAMA. He explained what happens to the average doctor that participates in a medical treatment for themselves and they've promoted it amongst their friends and family members. Then it's later found out to be ineffective or dangerous. Quote, and now it is psychologically impossible for them to come to the internal recognition that this has been a disastrous mistake for their own health and for the health of their family and their patients. This is so psychologically damaging. This is very similar to the days when doctors smoked and doctors advertised cigarettes. But it's not with everyone. There are people who can change their viewpoint when presented with new information, and it's all about how they identify as a person. I explained this more in the Anthem of Truth video, but basically, in a war, there are soldiers and scouts. A soldier follows orders without question, and a scout just seeks unbiased truth. Scouts want accurate numbers. Lying to themselves or their superiors is counterproductive and dumb. They just want the truth. Soldiers in war just want to follow orders to the death. If a scout corrects a soldier, they will get huffy and upset. They will butt heads. They will just always be upset with each other. Now, have you ever wondered what percentage of people with high work role saliency, like doctors, can change their mind when new information is presented? I have too. So in looking at sociological math, I found something called the Everett-Rogers diffusion of innovations theory, which is the gold standard for analyzing how new practices spread throughout complex healthcare systems. The percentage for these medical scouts is 2.5%. These people identify as truth lovers first and foremost, and they seek truth so that they can help others. They don't identify as helpers who can do no wrong because their motives are pure. These are the ones who love truth more than their egos. They have high tolerance for professional risk. They read the raw data rather than waiting for consensus guidelines, and they are willing to endure heavy institutional friction because they've studied and know what is and isn't true. They are the ones actually applying new things in the clinic when everyone else insists it's just unprovable or impossible. This is how the rest of the distribution breaks out. The translators and early adopters, 13.5%. These are highly respected, connected opinion leaders within the establishment. They don't invent or discover anything much, but they closely watch the 2.5%. These are the doubting Thomases of the medical world. They won't believe the science, they won't believe anything until they see it multiple times personally. Once that happens, the 13.5% adopts it. The bulk, the early and late majority, 68%. Then we have the majority. They only adopt a therapy when it becomes professionally riskier not to use it. Usually when it becomes the official standard of care. It's embedded in the clinical guidelines and has clear insurance reimbursement codes. Then we have the holdouts, the laggards, 16%. These practitioners will fight the new paradigm and stick to their old models until they retire. This is why the Nobel laureate Max Planck said, "Science advances one funeral at a time." So after an appropriate amount of science comes out, you are looking at a 2.5% probability of finding a doctor who doesn't take it personally and suffers from cognitive dissonance that would prevent them from instantly dropping doing harmful or ineffective practices. This tiny minority is just happy and optimistic that they have adopted more truth to help people. They don't mind the loss of social prestige and the vilification that comes from the other 97.5% of their peers because they aren't in it for the praise. They just want to see each patient, one by one, live better, healthier, and happier lives. The entire battle for the medical paradigm is just to shift the 2.5%, have them generate enough undeniable data to convince the 13.5%. Once these early adopters sign on, the establishment resistance breaks free, and then it's just a matter of the administration's adoption. I will paraphrase a story he told about his fellow surgeon regarding new evidence. A study found that a short course of antibiotics alone can cure appendicitis, thus not needing surgery. He tried it out, and it worked as described. He told his fellow surgeon about the study in his own personal testimonial, but he balked. "I don't buy it. I need to see a randomized controlled study." A few months later, a randomized controlled trial was published in their top surgery journal, confirming the same thing. About 75% of people with appendicitis don't need surgery. Relaying this information, his fellow surgeon colleague said, "I need to see 2 randomized controlled trials." The study was well designed and included a 1-year follow-up. But then 6 months later, another randomized controlled trial came out, published in JAMA, confirming the results. Now his fellow surgeon colleague said, "I need to see 3 randomized controlled trials." He told them about all of his personal success and how it's been used for a long time in Europe. I mean, what person wouldn't love not having to cut another human being open if they didn't have to, right? 2 years later, a 3rd randomized controlled study was published in a top journal, and separately, JAMA published an impressive 5-year follow-up results for the patients. All the studies, all the evidence, all the data had spoken. It was no longer an open question. Then he realized he never read any of them. "Marty, I just think people are better off with their appendixes out." Now, Dr. McCary defended him, saying he didn't seem like the money-hungry type. Quote, "He was a dependable and honest guy." Now, I know he's a fellow human being, but I confessed in the very first segment of this video that this is my problem. I just have unlimited contempt for people like that. What kind of human being would willingly and unnecessarily cut into another human being for money? But this is the lot doctors have to deal with, and we as society must turn this around. Half of what you learn in medical school will be shown to be either dead wrong or out of date within 10 years of your graduation. The trouble is, nobody can tell you which half. So the most important thing to learn is how to learn on your own. Dr. Sidney Burnwell, Dean of Harvard Medical School. In the medical field, how do we fix it? Well, in my opinion, raising awareness just seems to be a fancier way of whining. And you know me, I think that if you don't have a solution, that's all you're really doing. Fixing things takes years of dedication, frankly boring solo research, not burning up your time debating people who will never change their mind. We need a new approach. So I took all the data and put forth my best efforts in making a video titled "How to Fix the Plague of Cognitive Dissonance." The inability to change one's mind when new information is presented is indeed the biggest plague in modern times. And yet science confirms again and again that trying to educate people doesn't work. An illusion can never be destroyed directly, and only by indirect means can it be radically removed. A direct attack only strengthens a person in his illusions and at the same time embitters him. Kierkegaard. Now that guy is wise. We've all been duped at one time or another. We must start with ourselves and be humble and wise and sly. We must understand the high-stakes identity involved in changing viewpoints. And then we must employ indirect psychological means to overcome the plague of cognitive dissonance. Because the tribe's pack mentality is constantly being reinforced by the media. My video outlines a simple 3-step plan, and my approach may be entirely wrong and ineffective. I'm not preaching my way or the highway, I just seek truth. Let's figure this out together. I am 100% sure that somebody else can help polish, fine-tune, and make major revisions. Let's all work together to heal. Wouldn't it be great if we could all easily and quickly admit we were wrong, take zero offense, and go forward excited by the additional truth, making our lives better?